A mammogram is a digital X-ray of the breasts which uses a low dose of X-rays and which can detect cancers before that cancer becomes apparent to the patient or apparent to the examining provider. Recently, there has been controversy concerning who should obtain screening mammography and what the frequency of those mammograms should be. Here at Derry Imaging Center, we agree with the guidelines that have been set forth by the American Cancer Society, the American College of Obstetricians and Gynecologists, the American College of Surgeons, the American College of Radiology, and other organizations which all recommend yearly screening mammography beginning at age 40. "90% of screening mammograms are normal. About 8% of the time, your radiologist will detect a finding on the mammogram that needs further workup. And that may include additional mammography, it may include ultrasound, and occasionally MRI would also be recommended. If you are called back for additional imaging, please be assured that the technologist who did your mammogram did nothing wrong, and that most of the additional imaging that is performed is normal as well. But because there is a likelihood, small but real, that the abnormality detected on your screening mammogram is a cancer, we strongly recommend that you come back for that additional imaging. Screening mammograms are generally read the same day they are obtained or the next business day. If your radiologist is waiting for outside studies for comparison, the report will be delayed until those outside studies are received. If you require additional imaging because you are called back to clarify a finding on your screening mammogram, you will get the results at the time of your additional imaging. The only modality that has been shown to reduce mortality from breast cancer is mammography. But we have other technologies that can help us determine whether an abnormality is real and whether or not a biopsy can be performed under that modality, which would be more comfortable for the patient. Each of the modalities looks at tissue in a different fashion. Ultrasound provides different information than mammography, and MRI provides different information than either of the other two modalities. Sometimes an abnormality seen on a mammogram is best worked up with additional mammographic views. There are occasional times when we also need to add an ultrasound examination, particularly to see if a mass that we see on a mammogram is a cyst filled with fluid, which can generally be ignored, or is a solid mass that may require a biopsy. MRI is reserved for special occasions where we can't really determine the nature of an abnormality from either mammography or ultrasound. And it's not very often that we recommend an MRI examination, but sometimes that proves to be extremely helpful. Radiologists at Derry Imaging Center have a great depth of experience with image-guided breast biopsy, and we have been doing these biopsies for over 20 years. Breast biopsies can be done with a variety of guidance. Some are done in the stereotactic unit under mammography guidance, some are done with ultrasound guidance, and occasional biopsies are done with MRI guidance. In each circumstance, your radiologist will choose the best modality for you if you need a biopsy, the one that will be most comfortable for you, and the one that will yield the highest chance that the results will be accurate. In each circumstance, you will be provided local anesthesia, and once the anesthesia takes effect, a special needle will be placed in your breast to remove the abnormality and the surrounding tissue. The tissue will be sent to the pathology laboratory for analysis, and the results of that exam are usually ready in 3 days. At the time of the biopsy, under most circumstances, a metallic marker will be placed in your breast so that if you need surgery, your radiologist can help guide your surgeon to the correct spot. If you have a cancer on your biopsy, your surgeon will discuss treatment options with you. The nurse navigators at Derry Imaging Center provide a great deal of emotional and practical support to our patients. The nurse navigator will be with you during your biopsy. She can coordinate your future consultations with surgeons and other specialists. She can be a liaison between you and your primary care physician, and she can help smooth the waters during these very difficult times. Every woman who is 40 or older can schedule her own mammogram. There is no need to wait for your healthcare provider's order to get your mammogram. And at Derry Imaging Center, you can schedule your mammogram either by phone or through our website. At Derry Imaging Center, we are aware that women who come here for their breast health care are under stress and have varying levels of anxiety. We are fully accredited by the American College of Radiology for breast health care, and all of our radiologists are American board certified. All of the people that you will encounter at Derry Imaging Center, from the front desk staff to all the technologists and the radiologists, will provide support, compassion, and reassurance.